This is a self-help presentation. Please note all the information contained in this presentation is brought together from the NHS website. Community Action Northumberland are not medically trained. For heart attacks and strokes, call 999. Don't worry if you have doubts. Paramedics would rather be called out to find an honest mistake has been made than to be too late to save a person's life. At the moment, it can be hard to know what to do if you're unwell. It's still important to get medical help if you need it. Do not delay if you feel very unwell or think there's something seriously wrong. Call 999. If you have any of the following heart attack symptoms, call 999. Symptoms can include chest pain. The chest can feel like it's being pressed or squeezed by a heavy object, and pain can radiate from the chest to the jaw, neck, arms and back. Shortness of breath, feeling weak or lightheaded or both. An overwhelming feeling of anxiety. It's important to know that not everyone experiences severe chest pain. This is particularly the case with many women. The pain can often be mild and mistaken for indigestion. It's the combination of symptoms that's important in determining whether a person is having a heart attack and not the severity of the chest pain. Remember, if in doubt, call 999. Self-help. While waiting for an ambulance, it may help to chew and then swallow an aspirin tablet, ideally 300 milligrams, as long as the person having the heart attack is not allergic to aspirin. Aspirin helps to thin the blood and improves blood flow to the heart. In hospital, treatment for heart attacks depend on how serious it is. The two main treatments are using medicines to dissolve blood clots and surgery to help restore blood to the heart. Defibrillators. If you have a defibrillator in your village, check out the location and make a note of the contact details and codes. Anything you may need in an emergency situation, and make sure you have this information to hand at all times. Preventing a heart attack. There are 5 main steps you can take to reduce your risk of having a heart attack or having another heart attack. Smokers should quit smoking, lose weight if you're overweight or obese, do regular exercise, eat a low-fat, high-fibre diet, and moderate your alcohol consumption. If you think you're having a stroke, call 999. A stroke is a serious, life-threatening medical condition that happens when blood supply to part of the brain is cut off. Strokes are a medical emergency and urgent treatment is essential. The sooner a person receives treatment for a stroke, the less damage is likely to happen. If you suspect that you or someone else is having a stroke, phone 999 immediately and ask for an ambulance. Stroke symptoms. The main symptoms of a stroke can be remembered with the word fast. Face. The face may have dropped on one side, the person may not be able to smile, or their mouth or eye may have drooped. Arms. The person may not be able to lift both arms and keep them there because of weakness or numbness in one arm. Speech. Their speech may be slurred or garbled, or the person may not be able to talk at all despite appearing to be awake. They may also have problems understanding what you're saying to them. Time. It's time to dial 999 immediately if you notice any of these signs or symptoms. The best way to help prevent a stroke is to eat a healthy diet, exercise regularly, and avoid smoking and drinking too much alcohol. What should you keep in your first aid kit? It is important to have a well-stocked first aid kit in your home so you can deal with minor accidents and injuries. Your first aid kit should be locked and kept in a cool, dry place out of the reach of children. Many people also keep a small first aid kit in their car for emergencies. It may be helpful to keep a basic first aid manual or instruction booklet with your first aid kit. Medicines should be regularly checked to make sure they're within their use-by dates. This page lists items you may want to include in your basic first aid kit. This presentation is for information only. All content is directly from the nhs.uk website. For more health related information, go to www.nhs.uk. Please be aware that medical support and advice is constantly being updated. Check out the NHS website regularly for any changes. Thank you.